Okay, we're here again today with Dr. Walter Bennett, and this is going to be some really great stuff. We're going to talk about fibromyalgia, and this is some really cool stuff because fibromyalgia is huge. There's over 10 million people in the United States, and between 3 and 6% of the world population that suffers from this, and it's a really debilitating condition. And the biggest thing here is if you don't suffer with it, you really don't understand. You don't understand what a fibromyalgia sufferer goes through. It's really tough, and really they can tell you there's no treatments out there that really help them. There's a lot of frustration. There's a lot of false hope with doctors and marketers saying that they can help this, and then they invest time and they invest their money and stuff, and it doesn't work. And nothing's worse than that. And it's really difficult situation. So when Dr. Bennett told me that he had an advanced medical treatment that he was using that could possibly help, I scheduled this right away. And I don't know what he's going to talk about yet, but I got him on right away, like I said. And so Dr. Bennett is here, and he's going to tell us about this treatment. He's going to tell us a way that you can see if you qualify. And like I said, this is a medical treatment. This is not some supplement you buy on the internet or this or that. So, Dr. Bennett, you're there. You're going to tell us about this treatment?
Yeah, thanks for having me on again. With fibromyalgia, I use a 5-step treatment with it because virtually all fibromyalgia sufferers have some core commonalities. Now every patient's going to be a little different. They have, there's going to be a few different little nuances in them, but for the most part, all of them are going to have pain in the upper extremity and the lower extremity and on the left and right side. There's, 18 different places, 18 different points on there, and at least 11 of them are going to be painful. Now, everybody knows that part. Now most treatments are kind of trying to address the pain part, where they may give you some kind of pain medication or say an anti-inflammatory, maybe some steroid shots or dose packs or that kind of stuff, when it's really not addressing the cause of it, in my opinion. So I've kind of devised a 5-step plan that has done pretty well. Can I help everybody? Absolutely not. But we've been able to help a lot of people with this. The first thing is we want to look at sleep. Most people with fibromyalgia, they don't sleep very well. And when I say sleep very well, you want to go into that phase 3, phase 4 restorative sleep. And most of the patients with fibromyalgia do not go into the phase 3 or phase 4 sleep. If they do, it's not very long. Now, you're going to say, well, sleeping has nothing to do with my pain. But that's where people are wrong. It absolutely does have to do with your pain. Now, phase 3 and the phase 4 restorative sleep, that's where your body is going to produce growth hormone. Now, when your body produces that growth hormone, that is going to go into your bloodstream, and it's going to help heal all those little micro tears that you've sustained during the day. And most people, that's how it works. Now, somebody with fibromyalgia, what's going to happen, they're not going into that phase 3, phase 4 restorative sleep, so they're not getting the growth hormone production that somebody else would get. And they go through the same things, daily activities, and they get these little micro tears and things in their bodies and their muscles, and they don't get the growth hormone to help heal that at night. So it just kind of builds up and kind of spirals out of control, and then they end up with severe debilitating pain in a lot of cases. So the first thing I want to do is address the sleep part of it. So, and I do that by using something different. I'm not going to throw melatonin at people or prescription sleep medications that just are going to knock you out. Because what those do, they just, like I said, they knock you out. They don't put you into that phase 3, phase 4 restorative sleep. but there's a peptide that does. It'll help. It's called DSIP, deep sleep inducing peptide. And you get this, and it's an injection just right under the skin. And it doesn't, people think it's going to knock them out, but it doesn't. You get that injection, and then when you do go to sleep, it'll help you go into that phase 3, phase 4 restorative sleep and help you get the healing and the growth hormone production while you're sleeping that most people get. So that's the first part of it. Second part, this doesn't apply to all fibromyalgia sufferers, but a lot of them will have some immune issues. It could be anything really. Now, there's some peptides out there. It's thymosin alpha 1, but what that one does is it helps regulate T1 and T2 immune responses. So, but that, like I said, that's not for everybody. So we kind of look at people as an individual. The third part of our treatment is those trigger points I talked about earlier, those 11 out of 18 points that are tender, you go in there and you have all these muscles where they attach in there. It's very tender. So we use a peptide called thymosin beta 4. And what that one's been shown to do is it helps your body heal. It helps heal muscles and tendons and that sort of thing. So we go right into where the problems are, and we put that peptide in there, and it helps your body heal. Now, then the fourth thing we do, we're going to go in and we're going to look at your diet, because a lot of times people don't realize you really are what you eat. If you're eating a lot of pro-inflammatory foods, then your body's not going to react as well to that. So, for lack of a better term, we're going to try to clean up some of the diet issues that people are having, and that's going to be different with everybody. Then the last thing we do, we want to slowly start exercising again. The old saying, bodies in motion tend to stay in motion. You end up getting a lot more problems, and you're going to be even stiffer when you sit on the couch and do nothing. And I realize, people with fibromyalgia, a lot of the worst times are in the morning. They're really stiff in the morning, and it takes a long time to kind of get things going, but we'll slowly reintroduce them back into exercise again. And, each one of these steps helps a little bit. And when you put a lot of steps together, you make big strides in people's health. So that's kind of the method, and that's how we do it.
I think it's pretty important that you mentioned that there's a bunch of steps here, and little hinges swing big doors. And a lot of people try to do one thing, and they're into this, one pill, one medication, one exercise, and it's going to cure whatever it is that they've got. And a lot of health conditions are a lot of small things built up over time, and the solution is quite a few small things in combination to fix them, correct?
That's correct. And, you talk about a little about medication. There's really no approved medication for the treatment of fibromyalgia. That's what people don't realize. When they say, this, and this is for my fibromyalgia. No, it's being prescribed off-label. There's really nothing specifically designed for fibromyalgia. So that's why since there's nothing for it, I decided I was going to come up with a 5-step program to try to help people. And I just saw a commercial in the last couple of weeks, and it was pharmaceuticals selling a medication for fibromyalgia. And, it's the typical backdrop of happy people jumping around and being happy and this and that. And they were saying that it can help and this and that. And, I knew darn well that there wasn't a medication for it. And I guess they get around things by the way they word things, and attorneys word their marketing. And, yeah, as you said, as far as I know, there's no medication for fibromyalgia, correct? That's correct. There's nothing specifically designed for fibromyalgia. Now, doctors use a variety of different medications in treating it, but it's off-label. Like, for example, we talked a little bit about earlier about steroid dose packs, anti-inflammatories. I've even seen opioid pain medications. Zymbalta, antidepressant. They've found that helps with pain in some people. And, I'm not saying these things don't help, because there's certain people that it does help, but it's not going to help everybody. So, and all these things are being used off label. There's really no designed drug for fibromyalgia.
You talked about the peptides. What is a peptide?
Now, peptides are just amino acids grouped together. It can be 2 to hundreds of them. They perform a variety of functions in the body. A peptide can act as a protein. It can act as a hormone, a prohormone. So they aid in everything from digesting your food to helping heal cartilage to helping you go to sleep. I mean, all kinds of stuff. So peptide is a small word for a broad variety of things in the body that it does. And you're looking, I'm sure there's peptides we haven't even discovered yet. And, so you have hundreds and hundreds of peptides, but really about 25 or 30 are really designed and approved for medical use. And those are the ones that we're using.
And this is the first I've heard of your treatment here. And so you're taking some peptides, and one is to help with sleep. This isn't a sleeping pill, correct?
No, it doesn't even make you drowsy. It's DSIP, deep sleep-inducing peptide. It's not even going to make you tired. You get this peptide, and it's designed for when you do go to sleep. You're going to go into that phase 3, phase 4 restorative sleep that you really want to strive for. So it's going to improve your sleep. It's not going to make you sleep. It's just going to improve the sleep when you do go to sleep.
Because the sleeping pills, like you said, they induce sleep, but they don't give you the quality sleep. That's why a lot of times when you take that stuff, you wake up like you're hungover.
Right, you're groggy from it.
Yeah, and you were knocked out, but you didn't get the restorative sleep. The other peptide that you talked about, this one, the first one was to help you get the healing potential, the deep sleep. The other one was to actually help you heal, correct?
Correct. Thymosin beta 4 helps heal muscles and tendons. So we put that over little micro tears, and we can help the body heal those little injuries.
How are these peptides taken?
They're made. They're made in a pharmacy. They're not taken from people. No.
Well, no, what I mean is they're not taken like a pill, correct?
No, some of them are taken as a pill, but these are injectables.
Okay, injectable. So both of these peptides are the injectables?
Correct. And
the one for the sleep versus the micro tears and stuff. The micro tear one, I'm guessing, because like I said, this is the first that I've heard this too. That's going to be injected directly into specific sites.
Right. Just like we talked about in the stem cell injections, I'm going to use the ultrasound, and we're going to find muscle issues, and I'm going to use the ultrasound, and I'm going to guide the needle right into those tendon muscle areas.
Oh, so with your ultrasound, you could actually detect and pinpoint areas where these peptides should be placed.
Yes. If it's a micro tear, no, I'm not going to see that on ultrasound. But I can go by where the patient is having pain, and I can put the ultrasound over that and find the muscles under that and go into the muscles from that.
Oh, cool.
But if it's a small micro tear, no, I'm not going to see that on the ultrasound.
Okay, so you're not going to see the actual micro tear itself, but you can be guided by the patient's pain, and then ultrasound can guide you to put the peptide to help heal it in the proper place.
Correct. And with the ultrasound guidance in this application, the most important thing for me is it's not necessarily guiding you where to put it, it's guiding you where not to put it. You want to make sure you're not in an artery. You want to make sure you're not in the patient's cartilage, so it's guiding you where not to go as well.
Okay, cool. Yeah. So two important things here. One is the use of the peptides, and the other is the technology, the guided imaging that you have to guide the injections, just like with the viscosupplementation and the stem cell you do there. It is extremely important when you're going to use this type of medicines that these injections go exactly where they're supposed to be. Correct?
Correct. Now on the deep sleep inducing peptide, that one just goes under the skin. So no, I don't use it for that one. But for the muscle one, yes, I do. Now, I kind of lost my train of thought there, but yeah, like I said, so the deep sleep inducing one, that will just go under the skin. That's not a big deal. Now the muscle one, I want to go into the muscle or tendon right on top of it and put the peptide there.
What kind of results can a patient expect?
Now, that's a hard question to answer because obviously if you've had fibromyalgia for a month, if you just got diagnosed with it and it's fairly new, we have a much better chance of getting a favorable outcome as opposed to somebody that's had it for 35 years. Age depends on things. The older you are, the longer it's going to take. But with most patients, we're able to get some results. I've had some patients, have miraculous results. I've had some where they did get better. So everybody's a little different. So it's hard to say, but if you've had it for a long time, it's going to take a long time to really fix it. So, like I said, it just depends how long it's been there. But most people do get some results, and I'm not going to say that they're all going to be completely healed because I don't make those sort of claims. But most people do get some kind of results, and based on how long they've had the disease is kind of how long it takes.
I think the big thing here is we say this every time you and I talk, or I talk to another doctor. We say this, the ethical ones say this over and over again, that they can't guarantee results and that they can't even tell you what kind of results to expect because every patient is individual and treatment's individual. And any doctor that tells you that they can guarantee results or they could get you X% better, they don't know that, and honesty is a huge thing. And, especially with fibromyalgia, these people have been through the ringer, people are out there telling them it's all in their head. It really doesn't exist. Just, forget about it, move on. You're fine. They don't understand them. And then they also go and have treatments and they're promised the world and they're really delivered nothing. And there's a lot of lost hope out there. And so, trying to tell them something that can't happen or might not, I don't think that's the way to go, and if you have a treatment that possibly can help them and you can sit them down and you can say, hey, here's where you are. Here's what I think we can do. I'm going to be honest with you. I think this can help you. And I think this can help you live an improved life. We're not going to cure this. There's no cure for fibromyalgia, correct?
Correct. Yeah, there's not a cure. But what we want to do is improve people's activities of daily living, improve the quality of their life. I'm not saying I'm going to cure them because, like you said, you really can't cure something when they don't know what even causes it.
Yeah, it's and all the cure stuff, throw that out the window. But I think the biggest thing is here, what if you could get 10% improvement? Would that be worth to you? And I don't know, like I said, I've never heard of this treatment before. I don't know what this treatment can do, but Dr. Bennett's been on this interview, the webinars a lot with me. He's doing a lot of great work and, he's never told me anything that wasn't true. And he's getting a lot of great results. I've seen his results he's getting with arthritis and knees and stuff, shoulders and hips and everything. That's why when he told me, hey, I can help these people, I listened and we're here. And like I said, what if you could get 10%, 20% improvement? What does that mean to your life? Does that mean maybe you can sleep better? maybe you can, have a little less pain. Maybe you can do some of the things you really want to do. And are you going to get rid of all of your pain and everything? Dr. Bennett can address that next, but I'm going to tell you, from what I understand, no. So I mean, Dr. Bennett, about the people that they're really looking for some kind of cure, and they're looking for something fast. What do you have to say about that?
Yeah, like I said, there's no cure for this. So my goal with treatment is to help improve the quality of their lives. And I mean, like I said, I've had some people that the pain goes away. I've had some people, it gets X amount better. Some people it's Y% better. There's no way for me to actually tell you, Mrs. Jones, you're going to get 87% better from this. I can't say that. But, most people do see some kind of improvement. If you want, I can kind of go through what a first visit looks like.
Let's talk about that. Let's talk about, you're going to offer them a free evaluation, I believe, so they can come in. So yeah, let's talk about what they can expect if they come in to see you.
During the consultation, we kind of go over what's going on, what I do in the office, all that kind of stuff. If they want treatment, if they don't want treatment, I mean, we talk about everything like that. Now, if a patient decides they want treatment, the first thing I want to do is find out if they truly have fibromyalgia. I've had a lot of people that were diagnosed with fibromyalgia that's not what they had. First thing I'm going to do is run some labs. I mean, so the consultation is free, but I can't offer all the labs free because, I can't just go paying for labs for everybody. So the first thing I want to do is check their thyroid because, thyroid disease can mimic fibromyalgia. You want to make sure that there's no so you want to make sure it is fibromyalgia and not thyroid problems. So we're going to run some blood tests for that. We're going to check your vitamin D level, because of a very low vitamin D, these people can mimic fibromyalgia as well. You can get a little tingling, muscle aches into the arms and legs. So very low vitamin D will mimic fibromyalgia as well. We're going to check B12 level. When your B12 gets low, you can get omegablastic anemia, and that'll give you the chronic fatigue and all that kind of stuff. So it can kind of mimic fibromyalgia. We're going to do a CBC. We're going to make sure you're not anemic. Anemia will make you tired as well. We're going to do what's called a SED rate, an ESR, erythrocyte sedimentation rate. We're going to see if there's systemic inflammation in the body, because if there's systemic inflammation in the body, that's not the typical fibromyalgia patient. They used to think that fibromyalgia was an inflammatory disease, but now we know it's not. So I want to run that inflammation test, because if it's inflammation, that doesn't mean we can't help you. It's just going to be a different treatment, and it's not fibromyalgia. Then we're going to check magnesium levels, because a lot of patients that have fibromyalgia, they also have low magnesium levels. So when you're treating this disease, what you want to do is, for me personally, I want to be as thorough as I can. I want to make sure that they really do have fibromyalgia. I don't want to just go throwing stuff at it. I want to make sure, I want to know what we're treating. So it's kind of involved when you first come in to see me. So just kind of be ready for that.
I think it's important because too many doctors, they make a diagnosis based on just a quick little thing. And if the diagnosis is wrong, the treatment's most likely going to be wrong, and then you could run around with a misdiagnosis for a long time, because you go to another doctor and you tell him this is what I have. He doesn't diagnose you. He goes with that. And this goes round and round and round. And it's amazing how sometimes things just get misdiagnosed, and the diagnosis is so important, because like you said, if it's not fibro, it's something else. You have another treatment that can possibly help them, and if you don't figure that out, so it's really worth to spend a little time in the beginning to really figure out what's going on and what the proper plan of action is.
Oh yeah, I had a lady last week that came to see me that swore up and down she had fibromyalgia. We tested her thyroid. Guess what? She didn't. So we put her on thyroid medication, and she's back to normal now.
Yeah, it's incredible how sometimes it can just be a small thing, and I know you've treated a lot of fibro patients for many years, and one of the biggest things here is doctors. A lot of doctors really don't understand it. It's a misunderstood condition, and the patients are misunderstood. Like I said in the beginning, unless you have this condition, you really don't understand it, or unless like you don't have this, but you've treated so many of them over the years that you really do understand this. You understand what they're going through, but you really understand the condition, and you understand the clinical picture, and you understand how to help them because you helped so many of them.
Yes, and I empathize with them too. I understand this is a very debilitating condition, and I understand a lot of them get kind of thrown by the wayside, if you will. And even if the only thing I can promise people is I'm going to do my best to try to help them. I can't promise I can help them, but I can promise that I'll do my best. And in all these years, what I've learned is that's all people really want. They want my best, so that's what I give them.
Yeah, I think that's the important thing. And I remember I was at a doctor's office once, and a woman came out, and she was crying, and she said to the doctor she was there for fibro, and the doctor told her it really doesn't exist. It's all in her head, and I can still picture her, and I can see her tears, and that's a terrible thing to have to go through. And this that this condition's real. The suffering is real, and you're here for these people. You're here to listen to them. You're here to talk to them. And you're here to try to help them the best way they possibly can. And I think that's the most important thing. I think that even trumps any treatments that you have there, that you really care about them, and you're going to be honest up front with them, and you're going to try to help them in any way you possibly can.
Yes, that's kind of the gist of it. That's why I do what I do. I mean, I enjoy trying to help people, and I can't help everybody, but every patient gets 100% effort. I
remember a story you told me. I think it was a webinar. I don't know if it was the last one or a couple ago. You told me about a patient that you helped for, I think it was knee arthritis, and he handmade you a guitar, correct?
That was actually that was his lower back.
Okay,
and
back.
Handmade me a guitar.
Yeah, and I mean that's worth more than any money you've ever made, and I remember you telling me about that, and that's why you do this. You don't do this for the money, because I know that you charge less than most doctors around where you live. So finances for most people is not going to be a problem. But you don't tell me about the people that come in and pay. You don't tell me about that. You tell me about the people who make you a guitar, who send you lunch, who send you cards. That's what kind of doctor you are.
Oh, thank you. That's what I try to be. That's what I strive for. I just enjoy what I do. It's not, if you enjoy what you do, you stop working, right?
Yeah. I mean, I don't know how you could continue dealing with patients that are in pain and that are suffering. There's a lot of negativity there, and you make it a positive. You not only help people, you're just there for them, and you're building relationships with them. And I've said this before. You're like the Marcus Welby, MD today. You're like the old school doctor who didn't do it for the money. And when they come in, the first thing you don't ask them is, "What's your insurance?" You don't have insurance, get out of here. you're there for them. You're there to help them. And it's, you're using a lot of modern technology, and you're doing stem cell, PRP, all this kind of stuff, peptides. Marcus Welby, of course, didn't have, but you're like him with this modern technology today. And I've said this before, but it's important to say again, and that's why you're here, and that's why you have your practice. You have so many referrals. It's crazy.
Yeah, most of my patients get to me by referrals.
Yeah, it's if a doctor is constantly just marketing because patients come in and they leave, and he's got to market, there's something wrong, and we're doing these talks, webinars, stuff. We want to get the information out, and you're getting, people are beating a path to your door, and people are telling everybody, because when they go see Dr. Bennett, he's a great guy, knowledgeable, and he helped me. You got to go see this guy. And that's what people tell me. So that's the kind of reputation you have. And, the easiest way to really ruin a practice is to not deliver what you promise, and to not do what you say you can do. And because even a lot of patients are referring to you, more people, if you do them wrong, they're gonna tell more people, So if you're doing a lot of marketing and you're not coming through for people, and you don't deliver on your promises and stuff, believe me, especially today with the world, internet, Facebook and stuff, everybody's gonna know, and what's happening with you is everybody knows you really deliver, you care about them, and you're the doctor to go to.
Oh, yeah, I strive to be. Thank you. I like to put the information out there, and
I'm going to jump in here only because you hear him right now. He's so humble. He doesn't like when I'm talking about him like this. You know what I mean? But I just think people need to know. So how about now? Because I can see how shy you are. It's funny. How about we tell the people how they can get a free? You're giving them a consultation, is it?
Correct. We're doing a consultation. We'll sit down and talk about it, and then if the patient decides they want treatment, then we'll go for them. Then we'll start with the labs and that kind of stuff.
Cool. And so they can come in for free. They can get to talk to you, and they can see in person what you're really like. And I think they get a good picture of you here doing these webinars and stuff. And I encourage everybody to go to the YouTube and subscribe and hit the notifications button so that when we put one up, you get an alert. And you can hear Dr. Bennett. You can get a picture as to what he's really like, and that's why we do this stuff too. And you get to sit down with him and discuss your case. He'll tell you if he thinks he can help you, what the treatments are, and he'll tell you if he think he can help you. And if he can't help you, he's going to try to find the right doctor who can. So we're gonna put a number up on the screen here, and we're actually gonna put the website up too. And if you want to go there and you want to watch, some webinars are up there, some videos are up there. Give them a call. Subscribe to the YouTube. Check it out. And anything else you would like to say?
No, I think we pretty much covered it.
Yeah, it's great stuff. So like I said, I had never heard about this treatment until today. He called me and said, hey, I can help these people. And like I said, I believe him. So give him a call. It's free. Check it out. And see you guys next week.